I'm Dr. Mark Greenstein with Advanced Urology, and we're going to talk about prostate cancer. The prostate is a small organ that lives underneath the bladder. Its job is to help give nutrients and fluid to sperm so men can have children. After that, the job of the prostate is to get sick and give me something to do. Prostate cancer is when the cells of the prostate gland mutate and form cancerous cells that then aggressively and quickly divide and grow. Prostate cancer is the most common tumor and cancer in the male population. It is estimated that over 60,000 people will be diagnosed with prostate cancer every year. We know that upwards of 30,000 men will die from prostate cancer every year. And there are some statistics that say that 1 in 6 men will get prostate cancer at some point in their lifetime. Early phases of prostate cancer will not cause any symptoms. And usually, early prostate cancer is diagnosed by a blood test called prostate-specific antigen, or PSA, and a physical exam. When prostate cancer gets more aggressive and it starts to grow, then it will cause symptoms such as pelvic pain, blood in the urine, back pain, weight loss, and lethargy. Unfortunately, there is no clear-cut way to prevent prostate cancer, but we do know that men who eat a healthy diet, such as the Mediterranean diet, men who exercise daily have a lower risk of prostate cancer. There is also evidence that men who have a controlled cholesterol panel have less risk of prostate cancer, and men with the use of a baby aspirin every day can prevent prostate cancer. There are a few different guidelines on when to screen men for prostate cancer. I start screening Caucasian men between 45 and 50 years of age. This includes a PSA blood test and an exam. I will screen African American men starting around the age of 40 to 45. And I will also screen men where there's a strong family history starting at 40 to 45 years of age. Prostate cancer involves erectile dysfunction only in the advanced cases. In other words, when someone has a very high PSA, say like 100 or 1,000, and that cancer is growing outside the prostate, then it will cause problems with the erections. Also, if a man has prostate cancer that then we treat, there are some of the medications that can cause erectile dysfunction, surgeries can cause erectile dysfunction, and radiation therapies can cause erectile dysfunction. Once a man is diagnosed with prostate cancer, there are numerous options on how to treat that cancer. One option is to just watch it. We can call that watchful waiting. Some people will call that active surveillance. Another non-surgical treatment is seed implants. In other words, little pellets that are metal are placed strategically into the prostate, and they will emit radiation over a period of weeks to kill cancer. Another form is external beam radiation therapy. In other words, a patient will lie down in a radiation vault, which is almost like a CAT scan machine, and it will emit radiation to the millimeter to kill prostate cancer. There's newer technologies such as high intensity frequency ultrasound, also known as HIFU, and there's another therapy called cryosurgery where we actually will freeze prostate. In some of the advanced cases, we will also use hormone therapy to steal a man's testosterone away, basically putting him into menopause, and that will cause the cancer to shrivel up for a period of time. Many men are surgical candidates for prostate cancer. In many men, their cancer is just localized. In other words, it's just in the prostate and it hasn't spread anywhere. And we know that getting the gland out is a lot of times the best option for that individual. At Advanced Urology, we do both robotic surgery and open surgery. These are called robotic radical prostatectomies and retropubic radical prostatectomies.